more than half the parents in that, more of those 500, more than half were reporting actually that things were going well. In fact, almost 20% were reported that things were going better than they had before the pandemic, that they had managed to pivot into a way that made it feel like their relationships with their children were thriving. They were finding activities to do together that were enjoyable. They were making it fun. They were kind of teaming up to get the household, giving their children contributing activities to help. And sometimes asking a toddler to help doesn't make a job go any faster, but it can make it go better. and the extent to which they can make their relationship the primary focus of their work. Now, what we found was that the families that were doing well compared to the slightly less than half of families who felt like they were, it was probably around a third of the families who felt like they were struggling in some way, either that they were okay, but they didn't feel like they were doing as well as they could, or they really didn't feel like they were doing well at all. They didn't feel okay. Part of it came through the extent to which they felt like they had social support, that their spouse was contributing equally to keeping things going, because this has really fallen in an uneven way on women. There was an analysis of census data that came out that showed that 30% of, I might get the exact numbers wrong, but approximately 30% of women left their jobs when the shelter-in-place order started in order to take care of their children. 5% of men reported the same thing. So there was a great imbalance in the extent to which the home care and the child care fell on the shoulders of mothers compared to fathers, which shouldn't surprise anybody. That's pretty much been true for the history of families in this country and most countries. But the extent to which the parents in our study, both the mothers and the fathers, felt like they had an equal partner helping them, really helped to bolster their feelings that things were going well. So that the team was working well together. The extent to which they felt like they were able to establish that rapport with their children, to communicate with their children about, we're all going to help each other. We're going to get through this together. I know you're disappointed. I know you can't do this, but what can we do? Let's find activities that we can do. How can we connect to your friends? What are the games you can play online? How can we visit in the park or through the backyard fence and that kind of thing? Right. Made a big difference. For the emotional health of kids, there was a study done in Canada that came out recently, a big survey of adolescents. Physical activity and unplugging from media were two of the biggest factors for better emotional health. So those adolescents who were doing more physical acts, which pretty much meant getting out, walking, cycling, jogging, skateboarding, using physical equipment, doing things that are more individual than most adolescents usually like, because adolescents, of course, are very oriented on, or a large proportion of adolescents are oriented on interpersonal team activities. You can do a lot of those activities near your friends, if not directly interacting with your friends. Certainly you can make them social, but being physically active, getting exercise, and not being constantly on Zoom or Snapchat or TikTok or whatever was important for their maintenance of better emotional health.